I'm Matt Williams. I'm a consultant clinical oncologist based in London, and I'm also the medical director of Pear Bio. At the moment, the best way of matching patients to treatment is to take a biopsy of their tumour and measure some genes in their tumour and then say, if you've got this genetic alteration, we should give you this treatment. And that works quite well in some cancers, but there are some other cancers where it really doesn't work very well.
Hi, I'm Dalik. I'm the CEO of Pear Bio. The goal of Pear Bio is to help guide treatment decisions so that oncologists can look at a report and determine whether a certain treatment is going to be more or less effective for each patient. We're working on cancers where the 5-year survival rate is really low. In metastatic kidney cancer, there's a 12% 5-year survival rate, and patients with triple-negative breast cancer are expected to live for less than 2 years. So our goal is to shift that up so that patients can have a significant benefit and longer overall survival, because our test was able to help determine the right treatment option for that patient. Our approach is to take tumor samples from cancer patients and in our lab turn them into microtumors. These microtumors let us test different treatment options side by side in the lab to see which ones are more or less effective. Once we expose the patient tumor samples to different treatment options, we can then actually track the response over time by using live cell microscopy. And using those metrics, we can create predictions of response or non-response to each treatment option and feed that report back to a patient's oncologist. And at that point, they can decide whether a certain treatment looks better for that specific patient.
The advantage of the functional test is because you're using live tissue, you get a readout fairly quickly. So we think we can give a readout within about a week. The second thing is it's probably a better way of finding drugs that actually work for that person's cancer. And then the third thing is it's also about avoiding treatments that don't work.
The goal of this kind of test is to assign a treatment that's more likely to work for each patient without them having to go through a trial and error process.